So last week we started talking about chapter 24 from forearm and then into the wrist. And this chapter, or it's actually the same 24 chapter, but we're going to continue to talk about more detail of our hand and a finger. And this video primarily focus on the anatomy. And first, as always, we're going to go over some joints and the bony skeletal structures and then move on to the musculature. And then lastly, we want to talk about extensor expansion, which is kind of unique structure on your finger, the back of your finger. And lastly, conclude with the neurological innovation of our hand. All right, so let's talk about joints in our hands. Okay, so the first joint that I want to talk about is the carpal metacarpal joint. As the name suggests, it's a junction between the carpal bones and the metacarpals. Okay, so if you look at the first metacarpal right here, it's the junction between the trapezium, which is this one, and the first metacarpal. And for the second, trapezoid and second, and then we have capitate and a third and a fourth, a little bit of fourth, and we have a hamate between the fourth and fifth. Okay, so this particular joint is called a carpal metacarpal joint. Okay, from second through fifth carpal metacarpal joints, these are plain type of synovial joint, which means there's almost no movement occurring in this particular region. Okay. However, first carpal metacarpal joint is different from the rest of the carpal metacarpal joint. In that first carpal metacarpal joint, as I zoom in, is rotated about 90 degrees. So here, if I do this, you see the second through fifth metacarpals are lining right next to each other like a parallel manner. Compared to that, we have the first metacarpal joint facing this way, okay, instead of this way. Okay, so this angle makes something unique in this particular first carpal metacarpal joint. This first carpal metacarpal joint is actually not a plain joint. It is a saddle joint. Okay, so you can see the shape is different as well. That would allow us to create a movement of flexion and extension, a abduction, a deduction, and also a movement what we call the opposition. This is very special to the thumb. Okay, so we'll take a look at each movement here that's happening at first carpal metacarpal joint. And the first movement is the flexion and an extension. Okay, as you see in this corner, the flexion and extension, when you think about flexion and extension of the elbow, knee, usually occurs on a sagittal plane. Sagittal plane is the plane that bisects your body into right and left, right? So whenever the flexion and extension happening, it's happening on the sagittal plane. However, this flexion and extension happening at the first carpal metacarpal joint is on the frontal plane because of the 90-degree rotated positioning that we just saw. Okay, so don't get confused when you say flexion and extension of the first carpal metacarpal joint. It does not happen on a sagittal plane, but instead it'll happen on a frontal plane. Okay, the opposite would be true for abduction and adduction. Abduction and adduction of the shoulder normally happen on a frontal plane, right? The frontal plane is the plane that bisects your body into anterior and a posterior, front and a back. In this region on the thumb, the abduction and adduction happen on a sagittal plane. So flexion and extension, abduction and adduction is opposite, happening on the opposite compared to the rest of our body. Okay. The last movement is opposition. Okay, so opposition is rotation of first metacarpal against the trapezium as you bring your thumb, the tip of the thumb, and the pinky together. Okay, so this particular movement allow us to do a lot of the fine, delicate movement of the thumb, and including the precise gripping of a pen as we, write something on a paper. Okay. So that 3 movement happens on this first carpal metacarpal joint. So moving on to the metacarpal phalange joint. Okay. So these are the metacarpal phalange joint, and as the name suggests, it's between the metacarpal and phalanx, the proximal phalanx, right? And these joints are condyloid joint, meaning that there's flexion and extension, and a abduction and a deduction occurs in this particular joint. Okay. So in our hand, the middle finger, the third finger, is the axis of movement. So when I say abduction, it's away from this middle finger. So the second and fourth and fifth fingers are moving away from the third finger. The opposite, this is the abduction. Okay. My pen is not working really good today, but a deduction is when these other fingers are coming together towards the middle finger. Okay. Anyway, you get the idea. I can't really draw here. Oh, there you go. Okay, so that is abduction and deduction happening at the metacarpal phalange joint. Okay. And lastly, we have interphalange joint. For our thumb, we only have proximal and distal phalanx, so that's why we only have one IP joint. But however, for the rest of the finger, we have proximal and distal interphalange joint. So here's the proximal, okay, and then here's the distal, okay. And these are hinge joint. Okay, much like what we saw in the elbow, it only does flexion and extension. Okay, so there's that. And next section, we're going to talk about muscles. So here's the surface anatomy that you can, take a look at your own hand and then make sure where the location for each joint is. So from DIP, PIP, MCP, which is basically your knuckles. And then the CMC joint is actually located in way further proximal in our hands. So if I remove the skin, then you can kind of refer where the joint is located. Okay, so I want to start out with talking about musculature that are related to thumb movement. The first movement that I want to talk about is flexion. Okay, so there are 2 muscles that will complete the movement of thumb flexion. And the first one we already saw in the previous lecture is the flexor pollicis longus. Okay, so the flexor pollicis longus is this yellow highlighted muscles that are located in the deepest layer of your anterior forearm. So this is considered as an extrinsic muscle, which will have action of thumb flexion in our hands. Okay. In fact, this muscle inserts to the distal phalanx of your thumb, so it'll flex at CMC joint, metacarpal phalange joint, and even at the IP joint as well. Okay. The other little muscle that you're seeing is the flexor pollicis brevis. Okay, and the name is very similar, but the end is different. The longus versus brevis. The brevis means short, so it indicates this is the intrinsic muscle. It originates from the flexor retinaculum of your hands and then inserts to the proximal phalanx. Okay, so this particular muscle does not have an action at the IP joint, but rather it'll create the flexion of CMC joint and then the metacarpal phalange joint. The next movement that I want to talk about is abduction. Okay, so abduction, as we mentioned already, happening on the sagittal plane. So it'll look like this, right? So if I rotate, looking from the lateral side, it's lifting up your thumb up so that it's happening on a sagittal plane. So what muscle would do this movement? Okay, extrinsic muscle we saw earlier is the abductor pollicis longus, which is this bigger muscle that are located on a forearm. Okay, this is located on the posterior extensor side of your forearm and then inserts to the first metacarpal. Okay, once again, it'll create abduction of the movement, and this particular tendon creates lateral border of your anatomical snuff box. Okay, and along with that, we have abductor pollicis brevis. Okay, much like what we saw with the flexors, similar, right? So these two muscles together will create the abduction of your thumb. So here we have opponens pollicis, which is this little muscle in your thumb. Okay, so the opposition is a movement when you bring your thumb and pinky together. Okay, so this particular movement is complete by only the intrinsic muscle, so the opponens pollicis. And later we see opponens digiti minimi, which is located in the pinky side, work together to bring the fifth finger along with the thumb coming together to complete this opposition movement. So here, to summarize, this is the most superficial layer, abductor pollicis brevis, and then what's underneath is the flexor pollicis brevis. And then if I remove one layer, two layer, then you see opponens pollicis. These three musculatures are intrinsic muscle that are located in your thenar eminence. So the thenar eminence is this little, bump on the bottom of your palm on the thumb side. And within here, you have all those three muscles that has function of your thumb. Okay. And in addition to that, deeper, we have what we call the adductor pollicis. Okay, so the adductor pollicis has two heads, the transverse head and then oblique head. So I'm going to remove these connective tissue so that you can take a look at that in a better view. So here's the oblique head, and then here's the transverse head. Okay. These two together will create a deduction movement. Okay. We don't really have extrinsic muscle, which helps us to do adduction of our thumb. Okay, so only intrinsic muscle. So the first one is adductor pollicis, as we saw. And the second muscle, which will help us do the adduction of our thumb, is going to be the first dorsal interosseous. Okay, which is this one. So this particular muscle originate from the medial aspect of the first metacarpal, and it pulls the first metacarpal towards the second. Okay, so which is basically the movement of adduction, right? So this particular muscle and the adductor will complete the adduction movement. So the last movement of the thumb is going to be extension. So the extension of the thumb, which is on the frontal plane, is complete by three extrinsic muscles. So we don't really have an intrinsic muscle for this. So the three musculatures are what we saw in the previous lecture, which is the extensor pollicis longus, extensor pollicis brevis, and abductor pollicis longus. So these three muscles that we're seeing right now is going to create what we call the anatomical snuff box. Okay, so now we talked about the movement of the thumb and associated musculature. We're going to talk about muscles which create the movement of our second through fifth finger. Once again, the carpal metacarpal joint of the second through fifth is immobile or minimum movement, so we don't really have much going on there. But for metacarpal phalange joint, we have flexion and extension, and abduction and adduction. So first muscle that I want to introduce you is lumbrical. Okay, so the lumbrical is going to create flexion at MCP joint. At the same time, it'll also extend the phalange joint, both PIP and a DIP phalange joint, which we'll see that later. Okay, so but this particular muscle originate from a tendon, the flexor digitorum profundus tendon. Flexor digitorum profundus muscle originate from the deepest layer of your anterior forearm, and then the tendon comes down and it inserts to the distal phalanx, as we can see right here. And the lumbrical originate from the tendon and then inserts to the lateral or the side of the proximal phalanx. Okay, so what they do is it flexes at the MCP joint, as you can see in this movement here. Okay, so as the lumbrical contract, it'll create this flexion at MCP joint at the knuckle. Okay. But what's interesting is that the insertion point is blended with the extensor expansion. Okay, so extensor expansion hood is this structure, connective tissue structure on the posterior or dorsal aspect of your fingers. And then since it is connected to that extension expansion, contraction of the lumbrical muscle will leads to the extension of distal and proximal interphalangeal joint, which we'll talk about it more in details later when we talk about extensor expansion. So let's talk about adduction. The finger adduction happens at metacarpal phalangeal joint and complete by palmar interossei muscle. Okay, so palmar interossei only has 3 muscle belly, and it's between 4th and a 5th finger, 3rd and a 4th finger, and a 2nd and the 3rd finger. Okay, now there's the adductor pollicis that are right in front of the palmar interossei, but this particular muscle will do a adduction. So from, when the fingers are spread out, it pulls the finger together, so all the fingers are kind of like, aligned right next to each other, because of this particular muscles are pulling the 2nd into 3rd and the 4th and 5th into 3rd. Remember, the 3rd is going to be the axial or the axis of this movement, so these other 3 fingers are kind of moving towards the 3rd finger, the middle finger. Okay, how come we don't have 4? How come we don't have one that, the first metacarpal joint moving towards the 3rd joint? Because we do that movement, right? But the particular movement of adduction is actually completed by the adductor pollicis, what we saw earlier, the transverse and oblique head. So because of that reason, we don't really have palmar interossei muscle that are between 1st and 2nd. Okay, so what's opposite of adduction would be abduction, right? So the movement of abduction has, I would say, 2 parts. So the first part would be 2nd, 4th, and 5th fingers are moving away from the 3rd finger, but the middle finger could also move side to side towards the 2nd finger or the 4th finger. So those movement is considered as abduction, and that particular movement is complete by dorsal interosseous. Okay, so dorsal interosseous has 4 heads, and there's 1 head that are between 1st and 2nd finger, okay, which is highlighted in yellow, and then there's 2nd head and the 3rd head on the either side of the 3rd metacarpal. Okay, so because we have these heads, we can move our middle finger side to side. Okay, and lastly, we have this one between 4th and 5th, which moves the 4th finger away from the 3rd. Okay, and lastly, how do we move our pinky away from the 3rd? We don't really have dorsal interossei for that, but instead we have abductor digiti minimi brevis. Okay, so this little guy, the little muscle that are on the pinky side is not part of the dorsal interossei. It's an independent muscle, abductor digiti minimi. And the abductor digiti minimi will pull the 5th finger away from the 3rd, which assists this, completes the, the movement of the finger abduction. Earlier, we saw abductor pollicis brevis, so we have something similar on the thumb side, which will allow us to do abduction of the thumb. So the last set of muscles that I want to talk about is the hypothenar musculature. So as we saw in a thenar, eminence. We also have a hypothenar eminence, which is this area of, the bottom of the pinky. So in here, we have three major muscle. The first one is already what we saw earlier, is the abductor digiti minimi. Okay, so the abductor digiti minimi abducts the fifth finger. Okay, and if I hide this particular muscle, what we see underneath here is the flexor digiti minimi. Okay, so the flexor digiti minimi flexes the fifth finger at MCP joint. And what's underneath that would be opponent's digiti minimi. Okay, and this is what you need in order to complete the opposition movement when you bring your thumb and a pinky together. So we have exactly the same set of same set of musculature on the hypothenar and the thenar eminence. Okay, so once again, we have abductor, okay, whether if it's pollicis brevis or digiti minimi. We have flexor and then opponents. So those are the three same set that we have on both sides, the thenar or hypothenar side of the hands. Okay, so that would complete the musculature of our hand. Okay, in this next section, I want to spend some time talk about this triangular aponeurosis that are located on the back of your finger. This is called the extensor expansion hood, sometimes just the extensor hood. And what it is that recall that we saw earlier, or not today, but last week, we saw some extensor digitorum tendon that are going into each of our finger. And then also particularly for index finger, we have extensor indicis. For pinky finger, we have extensor digiti minimi tendon. Okay, so those tendons are actually going to insert to this triangular aponeurosis, which is the connective tissue. And then what happened is that as those muscles contract, it will not only extend at a singular joint, but rather it'll kind of have this harmony of extension at DIP and a PIP and also metacarpophalangeal joint. So the contraction of the extensor tendon will allow us to extend all the way at each joint. That's why we don't really have a separate muscle like what we saw earlier with the flexor digitorum profundus and a superficialis, how superficialis only goes to the middle and then the profundus goes to the distal. Okay, so this is the hood mechanism which allow us to do a full extension of our finger. What's related to that is this lumbrical muscle. Okay, so the lumbrical muscle, as we saw earlier, it originates from flexor digitorum profundus tendon and it inserts to this extensor hood on the lateral aspect. So notice that lumbrical muscle comes from the back and then inserts here, and then here's the axis of the MCP joint. So as the lumbrical flexes or contract, it will create flexion at MCP joint because, imagine pulling this tendon down will, bend the MCP joint. But since it's connected to the extensor hood, as the lumbrical contract, it will contract the extensor hood, which means that your distal and the proximal interphalangeal joint will go into extension. I hope that makes sense what I just said. So as a result, you have this D movement where the flexion of MCP joint and extension of PIP and a DIP joint, which resemble the shape of alphabet Z as you do it with your arm. The other connective tissue structure that I want to mention here is the pulley system. So for extensor hood system is on the dorsal aspect of your finger, but then palmar aspect has connective tissue that would prevent the bowstringing of flexor digitorum profundus and a superficial muscle, okay, or tendon, as I should say. So those two tendons are going to come down and it inserts to either the middle phalanx or the distal phalanx, right? So as they come down, in order for you to flexes those fingers at PIP or DIP joint, those tendon has to be attached to the bony structure. So what we have here's the tendon, and then there's the tenosynovium sheet that are surrounding the tendon, And in this each area from A1 through A5, it has this pulley system that would, make sure these tendons are kind of attached to the bony structure and not getting a bowstring. So the last part of the lecture, I want to talk about nerves and innervation and conclude this lecture. So first part is the sensory innervation. So this diagram here is showing which nerve is innervating which part of the skin in your hands. As you can see, the blue is ulnar nerve, which innervates the skin over your hyperthenar, and then also the fifth finger and the medial half of your ring finger. Okay. And then the green part is the radial nerve innervation. This is only the dorsal aspect of your hands, particularly from the thumb to the middle finger and half of the ring finger. But particularly the tip of those fingers are innervated by median nerve. Okay, so the pink region is the median nerve sensory innervation region. So this, if you notice, then as you evaluate an injury with specific tingling or abnormal sensation or paresthesia, then you know which nerve is the one that's getting involved with that particular injury. And for the motor innervation, this should be slightly reviewed. The median nerve comes down as a terminal branch of the brachial plexus and innervates most of the forearm flexors, right? And then also there's a little tiny branch that are after passing the carpal tunnel, they provide innervation to the thenar musculature that we talked about in the thenar eminence, including the abductor pollicis brevis and a flexor pollicis brevis and an opponent pollicis. Okay, one to note here is the adductor pollicis is not innervated by median nerve, even though it is located kind of closer towards the thenar eminence. The adductor pollicis is innervated by ulnar nerve. And the other muscles that in your hands that are innervated by the median nerve is the first and second lumbrical muscle. Okay, so those are the things that you should be aware of because it's important when you think about injuries. And here's the motor innervation of ulnar nerve. And once again, similarly to the median nerve, ulnar nerve is a terminal branch of brachial plexus. And it comes down, doesn't do anything in the upper arm, and does a little bit of innervation in the forearm, particularly the flexor carpi ulnaris, and then also medial half of the flexor digitorum profundus. But the majority of ulnar nerve function is in your hands. So those tiny intrinsic muscles that we just talked about, majority of them are innervated by ulnar nerve. The exceptions we already saw in the median nerve. Okay, so the radial nerve doesn't do anything as far as the motor innervation in your hands. So the ulnar nerve provides most of the innervation to the muscles in your hands. So as I mentioned, the radial nerve really doesn't have motor innervation in your hands, but also, it'll provide a sensory innervation to the back of our hands, as we saw earlier. Okay, so this would conclude the innervation, the sensory innervation and the motor innervation of the hands. And to understand that would assist us to evaluate a specific injury, particularly related to neurological functions. So in the second half of the lecture, we'll talk about some of the injury that could happen to our hands.